thank you for having me today. I really appreciate it to present some of my research. It's just going to be a brief overview of what we found and just a brief overview of what the lay of the land is for the topic at this moment, but we're hoping to expand on it quite soon. So I think let's just start immediately. Next slide. Okay, so I thought I would start with what the importance of human voice, or that the human voice is quite important for identity formation and also for gender expression. This is especially true for transgender communities, as it means that they might experience difficulty expressing themselves as their associated gender rather than the gender assigned to them at birth. Consequently, some research has found that voice-related quality of life measures among transgender people are significantly lower when compared to the general population, meaning that they view their voices quite poorly in terms of whether it represents them or not. So what is transgender voice and communication training? It is an elective intervention approach to focus on educating and counseling transgender people regarding appropriate verbal, nonverbal, and voice characteristics to increase the congruence of their self-expression with their associated gender. While transgender people do have the option of phonosurgery as well, these procedures are typically quite risky because they increase the risk of vocal fold paralysis, adenophagia, or painful swallowing after the procedure. And also, phonosurgery only addresses vocal pitch and none of the other aspects of gendered communication, which we know includes body language, articulation, types of language use, and also the the variability of the voice to adapt to certain situations. Phonosurgery also has, when surgeons perform phonosurgery, they also have less control over how much they raise or lower the pitch when they perform the surgery. So transgender voice and communication training really provides more flexibility in helping the patient, the client achieve their desired voice with their with that they want in terms of the pitch elevation. Research has also supported the use of transgender voice and communication training above phonosurgery, as the training has been found to have result in better voice-related quality of life outcomes and longer-term satisfaction among transgender clients. Given the extensive training received by speech therapists on voice anatomy, physiology, as well as the physics of vocal acoustics, they are really ideally situated to render this service. And that is the angle from which I approached this research, because I felt that we are in the ideal position to provide this service, yet it's not something that we are really discussing in our context at the moment, although there has been a boom in research in international literature, mostly in high-income countries. There's not really something we're doing right now. So currently, most of the research on the topic of speech language therapists' perceptions and perceived competencies have been produced in higher income countries, with one study being from India and the rest being from the USA, Australia, New Zealand, and the UK. Generally speaking, in all of these contexts, the findings were quite similar. The speech therapist generally knew that transgender voice and communication training falls within their scope of practice. They generally felt that it should fall within their scope of practice, and they felt uncomfortable providing the service due to a perceived lack of sufficient education and training to reliably provide the service and to ethically provide the service. Next slide. So for this study, I employed an online survey using non-probability, purposive, and convenience sampling. Invitations with the survey link was distributed online on professional-specific social media pages on LinkedIn, Facebook, and over WhatsApp. And then a custom survey was developed incorporating questions from the previous literature that I just mentioned, but also I added a few questions which were validated to really try and get more information on our local context. So the survey was divided in 3 sections. The first section wanted to obtain demographic information. The second section, factual knowledge of transgender voice and communication training, as well as gender affirming healthcare. What do the speech therapists know about the topic? and then perceptions and self-perceived competencies towards the LGBTQ plus population, although more of a focus was placed on the transgender population specifically. Next slide. So we were able to obtain a total of, sorry guys, I corrected some of the slides now, but it's okay. We obtained a total of 52 South African speech therapists who volunteered their participation. The majority were female. The majority did not identify as part of the LGBTQ plus community, but also the majority did know someone who identified as part of the community. The majority resided in and worked in urban settings, and they had not provided, most of the participants had not provided the service and or have been approached by people looking for the service, which I find interesting. Next slide. Okay, so a majority of the participants in the study reported that they had not received sufficient education and training in transgender voice and communication training during their qualifying degree curriculum, and that they felt quite inadequately prepared to provide the service to transgender clients. This is consistent with findings in the international literature, but of those who did not receive education and training of those who did receive education and training on the topic, this was largely theoretical. So in our context, there's not a lot of exposure during the training of therapists in practical context. It's mostly just theoretical training. Unfortunately, these results indicate that the speech therapists who participate in the study may not be able to serve the broadest range of individuals possible, which is really the mandate of healthcare professionals. However, interestingly, a significant age gap was identified as older participants were less likely to have received education and training on the topic, indicating that over time, speech therapy programs have started to slowly incorporate and gradually increase education and training on the topic, which could explain this age gap. Because younger participants generally also reported that they feel more comfortable working with the population. Next slide. So, similar to international literature, the participants generally held positive views towards the role of transgender healthcare, and they felt that it should form part of their scope of practice, which was good to see. Of the participants, 5 identified possible barriers to quality service delivery to the transgender population. And some of it I do think links with the previous presentation, some of the ideas, but some of the ideas identified were a fear of violating ethical parameters while being forced to see a patient that the clinicians are not sufficiently educated or trained to render services to. So a bit of feeling uncomfortable because they do not have sufficient training, which might result in them breaking ethical codes or crossing boundaries because it could be harmful to the patient. Concerns about potentially violating ethical guidelines if the clinician needs to advocate for a client, which in this scenario was very interesting to me because they really focused a lot on, let's say, for example, the client is underage and now the speech therapist wants to advocate for the client's services. How do they go about that if the parents, for example, do not want the service or do not buy into the service? So that was also an interesting ethical consideration for me. How far do we as therapists go? Concerns about their own competence in service delivery. This relates well to their feeling unprepared due to education and training. And then one outlier was identified. This is an individual who the participant felt that identifying as transgender is a psychological disorder and noted that it is unethical to treat such disorders by reinforcing the belief that gender can be appropriated, which is interesting language to use. This outlier, for me, I perceived it as potentially having a lack of sufficient knowledge of what what it means to be transgender, or has not had experiences where they've been exposed to the transgender population, whether in a social or clinical context. So I think that is some of the reasons why this could be. Promisingly, similar to literature from the USA and India, the majority of the participants did not hold moral beliefs preventing quality service delivery to transgender clients. Those who did raise concern in the study, as we've discussed now, highlighted themes of inadequate education and concerns regarding competence as the root cause for their concerns, rather than stemming from personal issues with the transgender population. However, this is not a representative sample of the whole community, which means that we do not, this is a good insight to have, but I do think larger scale studies are needed to really obtain a more diverse perspective of therapists. Um, okay, next slide. So most of the okay, this slide is just a some qualitative content analysis of what was seen amongst the participants. They generally reported that transgender voice communication training should be gender affirming. They have difficulty finding resources. Also, they reported difficulty obtaining insight from therapists already acting in the field, because they've and also gaining access to training on the field. Next slide. So, the participants in the study highlighted that while they feel comfortable working with transgender people, which is good, they do feel unprepared due to the education and training, resulting in also them feeling uncomfortable providing assessment and treatment for transgender voice and communication training. Interestingly, another hypothesis from literature postulates that older clinicians would be less likely to specialize in new disciplines or field of practice due to the work that they're already in. So most of the participants were middle-aged to older. So in this study, we identified that most of the participants who felt uncomfortable providing assessment and treatment were also a bit older, which could be because there's insufficient education and training for older therapists. But the literature identifies a few reasons why this could be, including that as I just said, that they are less likely to, if they're already specialized in one field, they are less likely to move on to a new field where they have to reestablish themselves, reestablish their skills, and they do not yet feel confident in that field. The participants also highlighted that gaining information for transgender voice and communication training service delivery is very limited, and that those who are already practicing in the field typically are not open to sharing this knowledge, creating an extra barrier to entry. So they suggested that perhaps it would be better to be taught at a graduate level, although in South Africa there isn't really specializations in speech therapy. There's only the general practice speech therapist, and then you can get a special interest and experience in, but there's not really a specialization in a specific field. But the participants did promote that as a possible solution. Then they also highlighted that there's a general lack of context-appropriate resources in South Africa, and that they currently have to rely on engaging with transgender influencers, which was quite interesting, on um, social media Facebook groups, discipline-specific Facebook groups where they can ask questions, although the participants are less likely, who already work in the field, are less likely to provide their own insights, and reading international articles and textbooks, which they also identified as those that have tried to practice in the field with less experience identified this as being difficult because a lot of the resources are not contextually appropriate and will make suggestions that our population unfortunately does not always have the resources to access or to do the practice at home or have that safe community where they can practice the strategies of in therapy. Next slide. So,
Johan, sorry, I'm
yes.
just going to let you have reached your time limit.
Okay.
Can I give you like 1 minute more to just sum up?
Yes,
Sorry.
this is the last slide before the conclusion anyway.
Perfect.
So the participants were asked to rate how well or what aspects of voice and speech language therapy intervention should be provided. They all said the most obvious one, pitch, vocal health, resonance. They focused a lot on voice. They want a lot of focus on articulation or language, but that does show a lack of sufficient knowledge, because articulation has been especially found to be important in the listeners, communicating partners, and how they perceive a gender identity. So it is important for for articulation to also be addressed. Next slide. And then the current study found a critical gap in the literature, which needs to be addressed. The participants feel, then the basic findings is similar to international literature. The participants feel comfortable working with transgender clients. They generally are aware that transgender voice therapy is part of their scope. They feel that it should be part of their scope, but they do not feel prepared to provide the service because of inadequate education and training. Final slide. So the final recommendations were just more research on the topic, more research on, I know there's research being done at Stellenbosch University from this transgender people's, the community's perspective on voice therapy. So I think it will be interesting to link those two. And then better education and training in facilitation for therapists, and then development of contextually relevant ethical and clinical guidelines.